and welcome to Case of the Day. I'm Dr. Crowley, and today we're going to discuss a case where a patient came in for a routine eye exam, and on the exam it was noted that their angles were narrow and that they're susceptible to developing acute angle closure glaucoma. So what do we mean by narrow angles? So basically a narrow angle is the angle is this. So there's an angle inside the eye where the iris comes out, and then the cornea, the clear part, goes up this direction. So this angle between the iris or blue part or brown part of the eye, inside the eye, and the cornea, the clear part of the eye, that is this angle here, either is open or narrow or closed. And so when we're talking about glaucoma, in 90-something% of the cases, this angle is open. That is, the distance from the cornea to the iris is open, and the fluid that's produced behind the pupil or iris is produced here, flows through the pupil, fills up the front of the eye, and then drains through this little trabecular meshwork into Slim's canal and out into the blood system. And so that is open angle glaucoma, is when this angle is open, it's just the fluid's having trouble getting through this meshwork. In narrow angle, then now this iris now comes up close to the cornea and across, and this is basically just due to the size and shape of the eye. So people who are very far-sighted means that, typically speaking, they have a small eye, so these structures are closer together. And so that's who we see narrow angle closure glaucoma typically in, are people who are very far-sighted because their eyes are small and this angle is narrow. So what happens in narrow angle glaucoma or acute angle closure glaucoma? As this fluid is trying to go through the pupil and get over to the angle, the iris actually abuts up to the cornea and blocks this meshwork 100%, so no fluid can get out of the eye, and so the pressure would suddenly rise and go up. Instead of being a normal range of 10 to 21, the pressure would be 60 or 70. And so what happens when people have acute angle closure glaucoma? They have severe pain, nausea, vomiting, blurred vision, even very, very blurred vision. They see halos around lights at night. Their pupils are dilated. Their eyes are red. And so this has happened years ago, many, many years ago, where people went into the emergency room and they had a dilated pupil. They were in severe pain around their head, and way back before we had all the technology we have today, people had an operation to their brain because the neurosurgeon was concerned that they had a aneurysm pressing on the nerve, blocking the pupil, and that pain was so severe they thought that that was an aneurysm. So the pain can be very severe. So this person today had a normal pressure. It's just that this angle is very narrow and looked like could close off in the near future. So what we did in this particular case is we're scheduled here to tomorrow for a laser iridotomy. So what we're going to do is laser an opening in the iris right here, and so now this is like a safety valve. So instead of the fluid having to make the track up here through the pupil and back around, part of the fluid can go directly into this meshwork through the little opening that's made. So this keeps the angle from closing off in almost 100% of cases. And so this is a preventative thing, because when people have angle closure attacks where their pressure goes to 60 or 70, if not treated very quickly, can lose their vision, and it causes severe trauma or damage to the eye. If you do come in, someone does come in with acute angle closure glaucoma, we have to try to get their pressure down because their cornea is now swollen, so it's hard to laser through the cornea sometimes because it's swollen, and we give people hyperosmotic solutions like Osmoglin, which is a very syrupy sweet solution, or actually a drug called mannitol that we do IV that helps just pull fluid out, and it will acutely lower the eye pressure. Diamox we give a lot of times, and then also eye drops, and everything we can do to try to get the pressure down enough to actually put the laser open in. Once this laser's opening is put in, when someone who actually has an attack, their pressure immediately drops and goes back towards normal. It is almost like an instant cure. So if the angles are getting narrow, then it's a wise thing to put this iridotomy in ahead of time because of all the severe complications related to having an acute angle closure attack. So if you have any questions about narrow angles or acute angle closure glaucoma, you can contact us through the website, and we'd be happy to try to answer those questions. If not, may God bless you with healthy eyes and great vision.